5 prominent medicines that cause liver damage. Did you realize that using prescription drugs excessively, including over-the-counter ones for headaches, can seriously harm your liver and even result in death? Some of these prescriptions you have probably used and may even have at home right now, don't you think? Today, you will discover the warning signs of liver damage, how to stop it from happening, and how to determine whether any of the drugs you use on a daily basis are damaging to your liver. The liver is the biggest solid organ in the human body and is essential to survival and good health. It tirelessly performs vital processes that humans cannot survive without, such as blood detoxification, digestive support, and energy restoration. This essential organ is also important for the metabolism of drugs. Sadly, certain medications have the ability to damage it directly, leading to a condition known as drug-induced liver injury. What, therefore, makes the liver so vulnerable to drug damage? Your liver is the unsung hero of your diet, drinking, and supplement regimen. It works non-stop to filter these chemicals, store nutrients, and remove trash. The possibility of coming into contact with dangerous chemicals is greatly increased by this continuous processing. Several studies have shown that a range of pharmaceuticals, including nutritional supplements and herbal medicines, can raise the risk of liver injury. In today's video, we'll discuss the 5 most popular medications that can harm your liver, what symptoms to look out for, and what you can do to prevent and safeguard yourself against these potential harms. 1. Tylenol. Acetaminophen, which is included in this popular over-the-counter painkiller and fever reducer, is typically safe for the liver when taken seldom and in accordance with suggested dosages. On the other hand, long-term or high-dosage usage may cause liver damage. Tylenol overdose, or liver damage, can occur with even one overdose of the medication. This is a medical emergency that has to be attended to right away. It's imperative that you contact the Poison Control Center, or get straight to the closest emergency facility if you think you may have overdosed. Liver damage might result from using Tylenol often or for a lengthy length of time. People who already have liver problems, alcohol use disorders, or chronic diseases are more vulnerable to this danger. Because acetaminophen produces a toxic byproduct during metabolism, it is recognized to potentially cause injury to the liver. Over time, this metabolite may accumulate and cause structural alterations in the liver that compromise normal liver function. The disease known as drug-induced hepatitis occurs when the liver becomes inflamed as a consequence of the effects of specific drugs, sometimes as a result of improper or excessive usage. Acetaminophen and niolide, 2 drugs that are known to be hard on the liver, can greatly raise the risk of acute or even fulminant hepatitis. 2. Diclofenac. Diclofenac, an anti-inflammatory drug commonly used to relieve pain from a variety of accidents and illnesses, including arthritis, is marketed under brand names such as Cataflam. Oral consumption, as opposed to topical administration, is the main cause for concern. Topical treatments, such gels, creams, and patches, have a decreased potential for liver damage since the medicine is absorbed by the body much less than when it is taken orally. Over time, chronic daily usage may increase the risk of serious liver impairment, especially in those who are predisposed to liver problems. SEDs, or non-steroidal anti-inflammatory medicines, are frequently used to treat fever, inflammation, and discomfort. Certain medications may be purchased without a prescription, but others, such oral diclofenac, Cataflam, require one. Among SEDs, Diclofenac is unique in that it may harm the liver. Frequently, damage of this kind may be sufficient to result in abnormalities on liver function tests, LFs, without manifesting any symptoms. Elevated levels of liver enzymes, which are proteins, can indicate liver damage and are measured by ELFs. These tests are done by blood samples acquired by healthcare experts. 3. Amoxiclavulanate. Many people have taken the antibiotic combination Amoxiclavulanate, sometimes referred to as Augmentin, to treat bacterial infections such as sinusitis, pneumonia, and urinary tract infections. Have you ever used this medication? Tell us in the comments if that's the case. Unexpectedly, Amoxicillin-clavulanate is one of the most common drugs linked to liver impairment, behind paracetamol. The mixture consists of an antibiotic and a chemical that prevents bacteria from developing antibiotic resistance. Although the particular mechanism is yet unknown, it is believed to induce liver damage through an allergic reaction within the body. Antibiotics such as isoniazid, trimethoprim sulfamethoxazole, and the antifungal medicine ketoconazole are among the other medications that are commonly connected to liver damage. 4. Statins. Because statins are so successful at lowering high cholesterol, they are among the most often prescribed drugs in the world. Well-known statins include rosuvastatin, atorvastatin, Lipitor, and simvastatin. They do, however, run the danger of causing liver damage. It is believed that these medications harm the liver by either generating a harmful metabolite or inducing an allergic response. However, the precise process is not understood. Another statin, Zocor, simvastatin. When a patient quits taking these drugs, liver damage from the drug is usually minimal and may be reversed with the help of their healthcare professional. In these situations, you may normally keep taking the drug, but if there is a significant rise, you may need to switch to a different statin. 5. Amiodarone. This drug is recommended to treat irregular heartbeats. Up to half of patients on long-term amiodarone therapy have been reported to have raised liver function tests, ELVs, albeit these elevations usually do not result in serious health problems. Nonetheless, a tiny proportion of users, roughly 1%, may sustain more serious liver damage. The FDA has given the medication a boxed warning, the highest alert level, in response to this possible risk in order to notify consumers and healthcare professionals about the substantial risk this medication presents to liver health. It is crucial for amiodarone users to regularly evaluate their liver function and to speak with their healthcare professional about any possible side effects. Can supplements cause liver damage? Yes, there is a chance that vitamins might harm your liver. Certain vitamins, like niacin, herbal products like ginseng and black cohosh, especially if it calls for large dosages or continuous use. If you experience any of the symptoms mentioned, it's critical to seek medical attention immediately. Bringing the medication boxes you've used in the past is also advisable for healthcare professionals to better evaluate your condition. But you should discuss their continued use with your healthcare provider, especially after experiencing liver damage.